Let me just start by saying that we are fighting what we could think of as a cultural myth in the United States, that we have this social and moral duty to be self-sufficient and to avoid dependency. And this is a long-standing, deeply historical myth. And people who believe this come to the conclusion that you who need government assistance are a social or moral failure, and or worse, you may be a malingerer, meaning someone who's cheating the system. And so this is a myth that is rooted in very old concepts of who's deserving of government assistance. I'm hoping everybody can see my screen now and this is working. So this goes to the question of what we think Medicaid is. Is it welfare? Is it a welfare program? Or is it health insurance? Or is it both? And the reason that we ask this question is that historically in the United States, social programs were tied to the idea of Elizabethan England that only the deserving poor could get access to social programs. And so you see this in the Elizabethan poor laws and the fact that there were workhouses. This carried over into how people were sold as slaves, using the language of able-bodied in selling people into slavery. And it also carried over even into the Freedmen's Bureau, which was supposed to help formerly enslaved people become members of American society as citizens. And the Freedmen's Bureau, too, emphasized that people who were able-bodied must work and that they would not get so-called government handouts. That would be a vain hope, as this Notice to Freedmen put it. So we have this long-standing, very sticky cultural myth that you have a social and moral duty to be self-sufficient and to avoid dependency. But the truth is, there is no such thing as an unsubsidized existence in the United States, and that is especially true when it comes to healthcare and health insurance in the United States. The idea here is that if you are self-reliant, you're engaging in paid work, you're active, you're self-sustaining, you're independent, you're a worker, you're a good citizen. But people who are considered self-reliant are still receiving hidden subsidies in the form of tax breaks when they have something like employer-sponsored health insurance coverage. On the other hand, the people who are deemed in this historical language undeserving poor are people who receive government assistance. They're deemed to be passive, parasitic, dependent. They're paupers in that old-timey language. They're bad citizens, right? They don't belong here. And there are people who tend to get visible subsidies like Medicaid, like the Children's Health Insurance Program. Less so with Medicare, because Medicare is key to having 40 quarters of paid workers' taxes. And so people consider that sort of getting your due, but it is still a very visible subsidy. So again, this contrasting language makes it so that the myth of self-reliance became very sticky over time. But one thing that became clear as the Great Recession of 2008 hit was that there's no such thing as a person who can get easy employer-sponsored health insurance coverage. And so what you can see here is that the number of people who were getting employer-sponsored health insurance coverage was decreasing over time. And especially as we hit the Great Recession of 2008, and especially for part-time workers. So people who were working part-time jobs were significantly less likely to be offered employer-sponsored health insurance coverage, and they were significantly less likely to be offered ESI if they were earning less than 250% of the federal poverty level. Further, if someone is both low income and working a part-time job, they would not be likely to be offered ESI at all. So the idea that a person is somehow shirking their societal responsibilities when they don't have employer-sponsored health insurance coverage was simply untrue. And it became painfully true during the Great Recession, which is part of what led President Obama to lead in this policy space to create the Affordable Care Act and to bring everyone to the table, to flip this narrative and to make it so that healthcare in the United States and health insurance coverage was no longer a non-inclusion system, but rather one of universality. The Affordable Care Act was designed to create near universal health insurance coverage, of course, still excluding undocumented immigrants, but it relied on a few key features of the U.S. healthcare non-system. It's not a system. And those key features included continuing to rely on employer-sponsored health insurance coverage, insurance market reforms that made it so that people could become insured and remain insurable, and also relying on expansion of eligibility for Medicaid, which until the ACA did not allow all people who were low income to enroll, but rather you had to be in one of the historic categories of being in the deserving poor: children, pregnant women, people who are disabled, people who are blind, elderly, etc. Then the health insurance exchange is built on top of Medicaid expansion to make it so that people who earn just a little bit more than you can get to qualify for Medicaid could get subsidized private health insurance coverage. So the ACA embraced a new principle, this principle of universality, that made it so that you could no longer be excluded from health insurance coverage just because you had historically been deemed undeserving of government assistance. Nevertheless, because the Supreme Court in NFIB versus Sebelius said that was optional rather than mandatory, we had states that have continued to opt out of Medicaid expansion. Of course, as you've probably seen in other places, this looks something like the old Confederacy. And even despite the fact that we had states opting out of Medicaid expansion, the ACA has been, on balance, successful in significantly reducing uninsurance rates in the United States. This became particularly clear to people when COVID-19 showed how the Affordable Care Act was able to tighten the safety net and make it so that people who were forced to stay home, people who were experiencing the public health emergency in a variety of ways, still had health insurance coverage. And so we have an all-time low health insurance coverage, uninsurance rate of 8% right now. But that number will increase significantly if the bill that's in Congress right now comes to fruition. Now, just to be clear, this is a long-term fight against the ACA. When the ACA was enacted, the first thing that states did, as I said a moment ago, was to fight its constitutionality by fighting it all the way up to the Supreme Court. But even after that, state politicians were keen to point out that they didn't think that Medicaid expansion should exist. And you see the same language over and over again. This is Matt Bevin in 2015 on an off-cycle election, the governor of Kentucky, saying, why should a working age person not be expected to do something in exchange for what they're provided? I want to clarify that this work requirement for Medicaid was for those people for whom it's not originally designed for. Go through any community anywhere. I promise you will see at least one sign where people want an able-bodied person who's not on drugs and will show up on time to apply for and do a job, right? So this rhetoric of people not being deserving of the government assistance of Medicaid is ongoing through the Obama years and into the first Trump administration years. You see the same thing over and over again. We can break the cycle of poverty, but not with programs that drag our communities and our people into the spiral of dependence, right? So when President Trump takes office the first time, his first executive order is to try to undermine the Affordable Care Act. But Congress learns in 2017 that repealing and replacing the ACA is not politically popular. And Mitch McConnell took it off the table as a continued political maneuver. Nevertheless, politicians in largely red states continue to bang this drum that there are certain people who are not worthy of this government assistance. It was never designed to be there for able-bodied adults. People need job training. Medicaid creates a new welfare entitlement system for able-bodied working adults, right? You see the same language over and over again. And we see the same language now. So if you didn't think that this was a fight against the ACA, I'm here to try to change your mind, because it absolutely is. It is a return to this idea that there are undeserving poor people in the United States, a fight against the universality of the Affordable Care Act. The messaging from the White House keeps saying, oh, well, we're not going to cut Medicaid, but we want to make sure that it does not belong to capable and able-bodied men who refuse to work. We want to protect and preserve Medicaid, but we're going to implement common sense work requirements. Well, as you're going to hear from my colleague Miranda in a few minutes, people are working on Medicaid. The problem is they work in jobs that don't offer health insurance coverage. We see the same rhetoric from Robert F. Kennedy Jr. and other leaders from the White House to the states. Whatever state you're in, we're seeing the same kind of rhetoric. If you're an able-bodied adult, you should work. Well, people are working. So what is even happening here? Given that the ACA is politically popular, what is Congress trying to do? The simple answer is that it is still trying sub rosa to repeal and replace the ACA. It just won't say so. And it is making tax cuts permanent on the backs of people who are low income. I'll stop there.